How did global cultures treat schizophrenia historically? Imagine living in a time when mental health issues were seen through very different lenses, depending on where you were born. That's how it was for people with symptoms now called schizophrenia. In many ancient societies, symptoms like hallucinations or strange behaviors were often linked to spiritual or supernatural causes. In parts of Asia, such as Vietnam, people believed these experiences were connected to ancestors or religious spirits. Patients might have thought they were haunted or visited by divine beings, and treatment involved traditional rituals, prayers, and family support. These practices aim to restore spiritual balance rather than treat a disease. In Western countries, the view shifted over time. In the early 1900s, doctors started calling this condition schizophrenia, meaning split mind, to describe the fragmentation of thoughts and feelings. Instead of spiritual explanations, the focus was on the mind and brain. But treatment was often harsh. Many patients were kept in asylums, sometimes restrained or isolated, because society misunderstood the illness. For example, in Japan during that period, people with schizophrenia faced confinement and strict control, reflecting stigma and fear. Over the years, Japan moved toward more modern treatments, combining medication and therapy, and worked to reduce the shame around mental health. In some developing nations like India and Nigeria, people with schizophrenia often did better in the long run. Families and communities played a big role in caring for their loved ones. Instead of relying only on hospitals, they kept patients close, involved in daily life, and supported their recovery. This community approach helped many manage their symptoms and live meaningful lives. In contrast, in some developed countries, social isolation and long-term hospitalization were common, partly because of less community involvement and more reliance on medication. Politics also played a part. In the Soviet Union, doctors sometimes used a diagnosis of schizophrenia to silence political opponents. Dissidents were labeled mentally ill to justify their imprisonment. This misuse showed how cultural and political views could distort medical understanding. Overall, how cultures treated schizophrenia in history depended on their beliefs, social systems, and political climate. Some saw it as a spiritual issue, others as a medical problem, and today we recognize the importance of combining these views to help people better.